Hi, everybody. We'll just wait a few minutes to start formally the webinar. Okay, I think we should start. So, good morning, good afternoon, or good evening, according to your time zone, and welcome to this new webinar of the Trevor Platt Science Foundation. The foundation, as you know, is an international organization dedicated to capacity building in science, research, and education related to our oceans, working towards stewardship of our planet for future generations. Today's webinar is one of the capacity building activities of the foundation. And before introducing our distinguished speaker, a couple of logistics. You notice, of course, your microphones are off. And please post any question in the Q&A session part instead of the chat, and we will get to the questions after the webinar. So now it's my pleasure to introduce Dr. Carla Campos. Carla serves as the coordinator in One Health and deputy director at the Institute of Science and Technology in Biomodels, ICTB-Fiocruz. She's also the scientific and technical advisor and deputy coordinator of the Blue One Health Initiative, Fiocruz strategy for the 2030 agenda, and the deputy coordinator of the Translational Research Program in One Health. Additionally, she coordinates the working group on ocean, coastal, and inland waters within the Translational Program. She has plenty of experience in national, Brazilian, and international committees on veterinary issues, as well as in the working groups of the One Sustainable Health for All Foundation and the Interinstitutional One Health Committee of the Brazilian Ministry of Health. So please, and she will speak to us, of course, about the Blue One Health. So Carla, the floor is yours.
Hello, thank you, Vivian. Thank you, everybody from the Trevor Foundation for inviting me for being with you today. And good morning, good afternoon, and good evening, everybody who is watching us. I'd like to ask Patricia if you could please share the presentation. Okay, thank you. So as Vivian introduced me, my name is Carla Campos, and I'm gonna present about the Blue and Health Initiative that we are working on here in Fiocruz, Oswaldo Cruz Foundation, based in Rio de Janeiro in Brazil. Next, please. So just a bit about our institution. It's a large research institution linked to the Brazilian Ministry of Health. And since its foundation, it's dedicated to the to strengthening our unified health system and also collaboration to the reduction of inequities in our population, and also working on the innovation and all the subjects related to health for our Brazilian people, and also collaborating with other countries. Next, please. There are these are the main areas that Fiocruz works on, which are many, and our institution is present in the whole country. We have facilities in 11 states, sorry, and but the projects and activities extend on the whole country. And most of them are all transversal and based on the social aspects and all the needs for improving the health of our population in Brazil. Please, next. I'd like to show you a bit about our work here in our institute. So the pictures you see are all from indigenous villages here in Rio de Janeiro, and just to show you a bit about the One Health approach in the practice. So we work in the interface between animals and the environment and people, and we are working on those villages, and we can see that the infectious disease mainly, they are very common because the indigenous people live in very close proximity with the animals and the environment. So we can tell you that the zoonosis disease are much more common in that population than in other ones. And we consider that the indigenous people, they live in vulnerable conditions, in social and environmental vulnerability. And also the animals, you can see the dogs are very thin, because they only eat the leftovers from the human population, and that population is having some difficulties for having food as much as they need. So we are working on that interface, and this is a very multi-professional and multi-institutional project. And I can tell you that the indigenous people are protected in our country, but still we have some challenges to face, and we are trying to help our Ministry of Health and the Environmental Ministry as well to work on that situation. And next, please. And these are other examples. We are working with the capybaras here in our campus to establish how much they can be used as bioindicators of the environmental health. We have a large population living just on the other border of the river in favelas, and the environment is there very degraded and polluted, but still we have many capybaras living there. So it's interesting to study them. In the middle, you can see the cats. It's an island where people abandoned the cats, There is a large population of cats, and it's pretty much an example of a Blue One Health subject, because we have the information that the dolphins are close to the island, that region. They are dying because of toxoplasmosis in a rate that is 10 times the one that is expected. So probably we have a social issue that is bringing an environmental issue for the island and for the ocean itself, and also for the animals. And only the mammals get sick, but all the fishes and other animals that are used as food for that population, they get infected too. They don't have the disease, but they carry the pathogen. So it's a public health issue as well. In the bottom, you can see pictures from animals and from an activity that we did with our Ministry of Health, of Environmental Issues, dedicated to support the activities in Rio Grande do Sul state after the floods that occurred there last year and were very severe. So many animals died, and we gave them the support with our institution and other professionals. So it was a very intersectoral and multi-professional, multidisciplinary activity. And on the right, you can see different cases of animals that are in danger, are sick, or in difficult situations, all of them in Rio, and different species. So when the animal is sick, the environmental condition is worsening, and also the people are in danger. You can see the cat, it's sporotrichosis, a fungus that is becoming more and more common in our country, and also affects the people. Next, please. So we consider in our institution the broad definition of health, that it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's why Fiocruz is very dedicated to the social conditions of the population and trying to reduce the inequalities that we have in health and in social aspects in general. Next, please. And we consider all the social determinants of health when we work in the One Health approach as well. And so we consider that the relationship between the animals and the environment and people are affected by the housing conditions, the education, and so on, that you can read in this slide. The animals, especially the domestic animals, are affected just like or almost like the people, as you saw in the pictures from the indigenous villages. So we need a healthy and stable ecosystem for the health of all of us. Next, please. And these are the main drivers of disease for our species, and they are already well known. And we have a growing demand for animal protein. The way we eat, especially meat, it's not sustainable at all, and it causes a non-sustainable intensification of agriculture and a change in land use, besides the urbanization, which are also linked to climate change, as you know. And we have this population increase, so it's expected that if we keep our feeding habits and we have the population increase that is expected, we are going to need 70% more animal protein than we need today. So it's already not sustainable. So we need to advance, understand how it impacts our health and the environments that we share, in order to change our habits or find solutions for those challenges. And poverty and social inequalities, we have also to think that if someone is living in vulnerability, in poor social conditions, or in poverty, nobody is safe. So it's more than empathy. the human-animal interactions that are changing with the changes in the ecosystems and also the changes in the land use. So we know that the contact between the animals and humans is becoming more and more common, and it's going to be more common even in the future because those changes are increasing. So the facility, the transmission between the transmission of disease between species is going to be more and more common, and also war and hunger. So we also need peace for having health. Next, please. So climate change is a good example of the needs for One Health activities and for the challenges for our health. And this is a slide about human health, but we know that everybody's health is being impacted by the climate change, and which is very much related to the ocean health, as you know. So air pollution and increasing allergens, it happens to the animals as well, drought, extreme heat, environmental degradation. So we are all victims. We share the challenges, and we are all victims in the same way. And we need to think as a connection to have effective results for all of us. Next, please. So we have shared risks for humans, animals, environments, and ecosystems. Next, Patricia. And again, the impacts of climate change on human health and our health. So if we have a damage in the infrastructure of the cities and for the wild as well, the animals are going to be impacted, and also all the balance is going to be broken, and then we have more and more diseases. Next, please. And we need to have an anthropocentric view. All life forms are affected. Next, please. Then there is a global recognition of the need for integrated, holistic, and collaborative approach, especially following the COVID-19 pandemic, because it was probably a zoonosis. And yeah, I think we didn't learn as much as we should from the COVID-19, but still we haven't seen advance. So please, next slide. So One Health is being an approach that is being advised, because it's an integrated, unifying approach that aims to sustainable balance and optimize the health of people, animals, and ecosystems in order to have more effective results for all of us. And then during the COVID-19, it's the OLEP, which was a tripartite group that was created, and now it's quadripartite. So it's composed by FAO, WHO, and WOA from animal health, and also from the UNEP. Next, please. And then One Health, it unites sectors and disciplines, society, to work together for a better health for us. And we need to involve the society in different levels in order to have those results that we need, and promote human and animal well-being. And those needs of water, food, energy, and air are very basic and one of the pillars from One Health. And we are addressing the climate crisis and the sustainable development at the same time. And next, please. So just a few underlying principles, then equity between sectors, and socio-political and multicultural parity, inclusion and engagement of communities, socio-ecological equilibrium, and we need change of behavior from all of us for having sustainable solutions. And we need transdisciplinary and multi-sectoral collaboration, which we are doing here today. So I'm very happy for being here, being a veterinarian and working to these wonderful ocean people. And something I'd like to say also about the key underlying principles, that you can see that the social aspects of health are all are always present in the One Health approach. Next, please. And then we have a lot of papers, scientific papers, stating that we need to operationalize the One Health. As you can see, it's not easy, because since you involve many sectors and disciplines and different professionals, putting them to work together is not easy, but it's something that we need to do, especially because we are going to save lives, but also because the cost of prevention of infectious disease is much lower than the cost of managing one, besides of course all the suffering involved. Next, please. These are some facts. So people are still going to bed every day or every night in hunger nowadays. It's something that's unbelievable. More than 70% of additional protein is going to be needed, as mentioned before, and we still have a lot of losses from animal production. And then we have all the environmental impacts, but we still have losses. As I mentioned before, as we have the environmental changes, the encounter between animals, domestic animals with wild animals, people with animals are going to be more and more common. And we have already altered the environments a lot. And also, if we consider as food sources, we are using the terrestrial food sources a lot, but we are at the same time destroying the ocean sources. So it's something that we really need to work on. The animal disease poses a direct threat to the incomes of rural communities that depend on livestock production. And once again, we have the social aspects, because the small scale producers are at a higher risk, not only for the economical losses, but also for getting sick, for example, from avian flu. And we have 75% of the billion people who live on less than $2 a day. They depend on subsistence farming. Next, please, Patricia. And this is what we have nowadays. 6% of all existing infectious diseases of humans, they came from animals, are of animal origin. And 75% of emerging or re-emerging human infectious diseases have animal origin. And 5 new human diseases appear every year, and 3 are from animals. And besides, 80% of the agents with potential terrorist use also came from animals. So it's very clear that we need to work on the One Health approach. Next, please. So we also have the economic rationale. It's much cheaper to prevent than to manage. Next, please. And we have also an opportunity, because we have many tools that are already available, One Health tools, and we have also the tools from ocean science. So it's something that I'd like to bring for us to think about, is how to connect those tools. Next, please. Next. And I'd like to mention also, we had the COP16 in Colombia, and this is the decision adopted from that conference. And as you can see, the One Health approach is recommended, highly recommended. So we have the biological diversity is very clearly connected to our health. And then it's something else that we could work on for thinking about ocean science. Next, please. Now, as you know, there are so multiple use of the ocean, and we have all the impacts. So we use the ocean for transportation, cultural expressions, well-being. Nowadays we have the blue prescriptions and the blue gym. So it's very well known the benefits that we have from the ocean. We use the ocean for sports, water recreation, ecotourism, fishing, oil extraction, and it influences a lot our economy and tourism. Next, please. So I think that the audience knows much better than me, but there are so many benefits from the ocean, benefits that impact our health. So it covers the 70% of our surface, contains 94% of all wildlife, presents more than 97% of the planet's water. So it's very, very important for our water cycle. It's a large carbon sink and produces most of the atmospheric oxygen. And we have the important role of corals and regulates the climate. There are some important biomodels used for research that come from the sea, international diplomacy, food. There's many medicines that come from the sea, and also that we know that many other principles that would be very important for the whole population for treatments are already have already been eliminated from the sea, and also the same for the ocean microorganisms. Next, please. So it's very surprising that ocean matters are not supported accordingly. We know the SDG 14 is still the most underfunded, and it's not commonly approached in the One Health strategy. Actually, the environmental aspects of the One Health are less supported, less worked than the animal health and the human health. But considering the environmental health, the ocean is not worked in the strategy as it should. And we need to have a lot of attention for not having One Health that is anthropocentric as well. Next, please. But there is a lot of important work being done. This picture shows some of the connecting approach on the ocean climate nexus studies, and it shows that only 24% of the studies mention the ocean. Next, please. So we have many studies that show that the relationship between the ocean and health, and the need for the One Health approach. Next, please. Then that's it. We need the ocean influences our health, so we need to consider it when working on the One Health approach, which is more than zoonosis control and antimicrobial resistance. Next, please. Then we have a close relation between the One Health issues and the ocean issues. Next, please. And as I mentioned before, important work is being done. Some of them clearly states one ocean, one health, oceans and human health. So we are advancing, and we in Fiocruz, we would like to add to the other works that are being done and collaborate with all those important studies. Next, please. And that's it. On the most basic needs, from breathing, hydration, nutrition, and shelter, we need the ocean for our health. Next. That's why, we initiated this movement that we named the Blue One Health. It's not a small box or a silo in the One Health approach, but it's more like a tool in the One Health approach to bring light for the ocean, to the ocean. Sorry, next, please. So it recognizes the deep interdependence between the ocean health, human health, animal health, and plant health, and integrity of the environment and the ecosystems. And that's important to say that it happens to the ones who are close or beneath the water surface, but also for the distant people and the animals. And it's something that we like to work on and give attention to it. And we are doing this movement, this initiative with many partners, and we'd like to have more and more partners for being stronger. Next, please. So some of our objectives are sharing knowledge for ocean and planetary sustainability, promote technical and scientific cooperation and diplomacy, implementing strategies, stimulate funding programs because we need funding, empower society, and integrate the ocean in the One Health research and the national joint plans of action. And also support the 2030 agenda and decade of ocean science. And I forgot to mention that the OLAP, the group, the tripartite group that I mentioned before, they are stimulating the countries to have their One Health joint plans of action. Brazil is working on it. It's going to be launched in November. And it's very important for us to have the ocean included in those plans. Next, please. And all the key themes, I'm not gonna go through that because we don't have much time. Next, please. So this is a bit of a roadmap. So we understand that we need policy advocacy from the beginning, and then work on the capacity building. And important point is surveillance and early warning. So it's something that we really need to ocean science people and health people and the environmental people to work together, because we need to better predict and have models for better understanding and warning, and research and knowledge, of course. We need governance and collaboration. And in that aspect, we are working on the establishment of a Brazilian virtual One Health Institute with a network related to it. Next, please. So there is a call for action, and in order to recognize the ocean as fundamental for health and life, using the Blue One Health strategy and mobilize funding, as I mentioned before, invest in science and early warning and awareness. And we need urgently to be successful in inspiring people, inspiring all the population towards the need for a positive relationship with the other people and with the animals, ecosystems, and the environments that we share. Next, please. And we understand that we have only one ocean, only one health, only one planet, and only one future that we need to shape. So One Health is much more than empathy. We need to think about the others all the time, no matter the species, but it's not only for empathy, which should be enough, but it's also for the health of all of us. Next, please. And some proposals to adopt and promote the Blue One Health. Some aspects that we need, which again, advocacy, policy and planning, knowledge, evidence, that it should be very clear, especially for the decision makers, there is a close link between human health and ocean health. And modeling and the risk of prediction are part of that. Next, please. And we need global collaboration. We have only one ocean, and then it's something that we need to do together, and then support the implementation of a world network of One Sustainable Health Institutes. It's something that we would like to collaborate. We have this partner that Vivian mentioned before, the One Sustainable Health for All, which is based in France, in Lyon. and we are collaborating with them. We hope that we have the Brazilian One Health Institute, which is going to be a part of the world network of One Sustainable Health Institutes. And and our network needs to be transdisciplinary, intersectoral, and interinstitutional, and include the ocean-related issues in the One Health tools. It's something that we understand that we have to work on. Next, please. So we also understand that doing that, we can support the ocean decade as well. And we need a predictable ocean, a health, a clean, safe ocean, and sustainable and transparent. Next, please. And of course, that's for societal outcomes, for human outcomes, but also for the animals and environmental and ecosystem health outcomes as well. Next, please. Next. Then we understand that we are going to also support the ocean decade challenges. Next, please. Promoting the change in the way that humanity relates to the ocean. And next. And also promoting knowledge. Next, please. So this is just an example of the way that the people in Brazil understand the relevance of the ocean. There was the survey, and people understood that the ocean is important because it's a source of food and because it's a source of leisure. But it's much more than that, and we need to make this connection clear for the people that we need the healthy ocean for being healthy as well. Next. So an important collaboration would be exactly to that, to change the way that people understand the ocean, because we need a healthy ocean to have climate stabilization, water security, air quality, and food security, in order to have healthy people, healthy ecosystems, and healthy animals, and a healthy environment for all of us. Next, please. And these are the connections. Next, please. So we propose to work together for better results and inspire people towards a paradigm shift. Next. To make people understand that we need a clean, resilient, and safe ocean to maintain life and health for us, for all. And all this picture shows show our relation and are examples that the way we need the ocean for our health. Next, please. And we need this paradigm shift. We need to understand that if we think about the poor people, we are not just having empathy, we are working for our health, for all of us. And the same thing for the animals that are in vulnerable situations, and the way we relate to the environment, to the way we treat the environment, the way we eat, and all the habits and the impacts that we have in the environment. Next, please. These pictures just because I consider them good examples about our connections, because all the green turtles that get sick when they reach the coast and get in close contact with us, and having all the tumors and the plastics, and you see the fishing line in the bottom left turtle. And these turtles live here in Rio de Janeiro, and you also can see the oil on the water surface. So we are all affected and affect the environment and the health of other living beings, just like ourselves. And I'm gonna leave my contact details in the bottom. And thanks a lot for hearing me, for being with us today. Thank you.
Thank you, Carla, for this very interesting talk. Certainly, you reminded us of all the connections and how the ocean is at the core of life on the planet. And it's good to see that the ocean is getting into the table of health. So thanks for this. And now we're going to see if we have questions. We don't have questions right now, but then I will have I will take the opportunity. Just a very general, maybe a reflection on your part, since you are so linked to these issues. How do you see, apparently in Brazil is being taken very seriously into the health ministry, but you see a good repercussion in the decision takers?
Related to One Health in general, you mean?
Yes, One Health and the ocean included.
Yeah. Well, One Health, I think it's very well accepted nowadays. We have this working group that is composed by different ministries, and different institutions and different backgrounds, but it's coordinated by our health minister. Actually, the zoonoses coordinator is the coordinator of this group, and we are gonna, hopefully, be able to launch the plan in November. We have the One Health Day in November. But to link the ocean to the One Health or to health, it's something that we are still working on. People know, but not deeply. I think that well, sometimes people don't realize the relevance that we have, that the ocean has. Especially if we are not close to the coast. When we start talking about that, usually people from the health sector, they say, okay, the riverine people and the coastal communities and island communities, but it's much more than that. And we have to understand that, to make people understand that the waters connect us, unite us. Then if there is, all the toxic products that are being used in the agriculture far from the coast, they are going to end up, polluting our water, which is very clear for the people who work in the ocean science, but it's not, straightforward to other people to understand, I think. And then I think that there is a challenge for us, to make all the connections and make people work together, and also that change in the behavior of the community. That's something I think that we need to do, change the way that people relate to others and to the environment and to the animals.
Yes, it's true. It's how to convey the message and to make it clear. And you said something in your talk, we didn't learn as much from the COVID. And I was thinking about that because it's true. It was an example of zoonosis, most probably, and affected the whole world, everybody's life. And it would be good to pose these questions before something as bad as that happens. So it's good.
Yeah.
So we have now a question. There was a question from Lika in the chat. Lika Krug is from Brazil as well, although she's in Portugal right now. She said, great presentation. What kind of projects Fiocruz are currently developing, and what kind of ocean data they require?
Okay, so we are working on that connection still here, but Fiocruz, I don't know if you have heard about it, the Fioantar, which is a large initiative with other institutions in Brazil. So they are monitoring all the microbial, communities in the Antarctica, and then they connect the samples and bring those to the labs and are watching, doing surveillance for considering all the climate change that is going on. That's one example. We have many works with local communities. There is a large activity project. Program actually, that is an observatory, right? In English, observatory. For sustainability and health, and they work with local communities from the coast, from São Paulo and Rio de Janeiro, and all the activities that they do, they come from needs that the communities tell them. So it's very, very interesting. And then they will help them in many ways, and they connect the communities to the institution, and also to policymakers and to decision makers as well. There are many, because Fiocruz is huge, we are more than 12,000 people working in this institution. Some people monitor the quality of water from the rivers and from the sea, and monitor the health of sea animals. We had recently some results from the sharks in Rio, and they had cocaine, cocaine in their meat. So yeah, and we are very curious to understand how that's cocaine got in their meat. We don't know yet. And well, there are many studies, and what I think is that we need to better understand how we can directly connect to the ocean people, because we have many people working with health issues that are related to the ocean, but we still need to improve the connections. That's, I think, something that we should, if we could move on, talking about something, that's something I think we should do. How can we better connect and work together?
Yeah, that's good. That's good. But you mentioned that you are involved also in this Decade of the Ocean and
we do a lot
health. So that's
we do a lot of advocacy as well. So the Blue One Health, we are in this phase, pretty much advocacy. So we are trying to make the connections with other institutions and professionals in order to have a network, and then take the other step to work together, to collaborate and to have the joint projects and activities, so we can better have products for the society.
Yeah. Well, actually, I think I was going to read the question that I think you just answered or commented on. That is from, sorry if I mispronounced the name, Shashandata Nayak, and says, how can future partnerships under the Blue One Health approach strengthen global strategies for ocean sustainability, resilience, and human well-being?
Yeah, that's a good question. That's something hopefully we can make a change on that, because health is very important for all of us. And I think that if we can show and change the way that people understand that our relationship on the ocean is something important for their health, for the planetary health, for everything, we can support more investments for the ocean sustainability and for the ocean health. But it's something that we need, to do step by step, and it takes time. It takes a lot of advocacy, and it's something that I think that Fiocruz can collaborate a lot with that, because we are, 125 years public health institution, and we have a lot of connections in Fiocruz, and hopefully we can collaborate in some way to change the way that policymakers understand the relevance of the ocean.
Yes, good. Here there is another comment from Priscilla Lange, that is also from Brazil, and she says, great presentation, Carla. You can count on INPO to articulate with the ocean research institutes in Brazil. So we leverage cruise data and local regional efforts as much as we can.
Oh, thanks a lot, Priscilla. We are really counting on Info to tell you the truth. Yeah, Info is actually one of our collaborators. We are not formally, collaborating, but we are in connected. We have other collaborators from São Paulo, from other states. So I'm very happy that we are advancing on it.
Okay, good. So Nayak also thank you for answering his question. And we have a comment from Shuba. She says, great presentation, Carla. Let me see, I lost it now.
If we collaborate with other South American countries, I think.
Okay, good, thank you, yes.
Yeah, that's the idea, actually, because of course, we need to strengthen our Brazilian network, but we would like to do it at the same time. We don't need to wait for the Brazilian network to be established and complete to collaborate with other countries. So yes, it's something we'd like to do. It's pretty much something that Fiocruz already does. We have a new Vice-Presidency in Fiocruz, which is dedicated to global health and international connections, relations. So yeah, if something is interested in collaborating with us, please let us know.
Yes, it would be good to spread the word around and make the connections in between countries.
Yes, sure.
Especially, I think, to make send a message about the importance to health, to society and economy, because we know sometimes our politicians are more concerned with economies. But as you showed, of course, it's all connected. And send these messages is very important. Once it reaches the people and the decision makers, hopefully will. But we have to insist on that message continuously.
Yeah, that's a good point. Yeah, communication is something that we need to do and work on it. And also, as you mentioned, the numbers. I read about the how much a great whale is worth. So it may sound a bit weird, but it's something that we should do. How much the connection between ocean and human health worth? It's something that for the decision makers is something that matters. Yeah.
Yes, it's important that a lot of people knows about it. It makes a difference. And here she was also curious about who is or was Osvaldo Cruz, and how did he inspire the foundation?
Yeah. Osvaldo Cruz, he was our founder, and he was a public health epidemiologist, and he studied in the Pasteur Institute. And then when he returned to Brazil, he became in charge of facing all the diseases that were common in our country by that time. And it was cholera and the blue plague and so on. So he became our Minister of Health. After that, he founded our institution, and he worked a lot against those diseases. But he was very brave, so he got in the houses of people at that time, and he started burning their beds, and he did a lot of things that people didn't like by that time. But after that, it was understood that it was all necessary, and people became healthier and understood that he did it. It was right, Yeah, but he inspired our institution, and he created a castle here where we work here in Rio, which is very common in Europe, but not common here. And he wanted, a symbol of science that we had, the castle of science.
Yes, the beautiful building that you showed in your first slide, isn't it?
Yeah, that's it. Yeah. It's a Mauritius style, yes.
Yeah, very nice. So I don't see more questions here. So thank you again, Carla. It was a very interesting and complete presentation with all the integrations of the parts between health, environment, animals, the ocean, and management, you know, of the subject. So thanks for accepting to give this talk at the Trevor Platt Science Foundation. And we hope to keep you in the loop and being part of the other webinars and so on.
Thank you. Thanks a lot, Vivian. Thank you, everybody. I hope we can inspire people towards that paradigm shift. Thank you.
Okay, thanks. So if there is no other comments, so please keep checking the news from the Trevor Platt Science Foundation for our next webinar, which hopefully will occur at the mid of October. You will receive the announcement. And in the meanwhile, well, stay well and all the best. Okay. Okay, so we finish officially, and